All right, well, we are ready to begin. Okay, great. Thanks for joining us. It's great to see everybody here. I'm Mona Baset. I will be one of the panelists, but also moderating the panel too with all my friends up here. So we'll just go ahead and start with some introductions. I'm Mona Baset, Vice President of Digital Services for Intermountain Healthcare. And Intermountain is a large not-for-profit health system based primarily in the Mountain West in 7 main states, based out of Salt Lake City, Utah. I'm based out of Denver. And my team really specializes in all of the consumer and caregiver engagement types of technologies and strategies. And that means everything from websites to intranet sites to CRM, our mobile applications, our patient portal, as well as intelligent automation, of course. And my background is both in marketing and technology. So it's been an interesting perspective to bring to the table with all of this new innovation that is ahead of us. So I will turn it down to all my fellow panelists. You can introduce yourselves.
Sounds good. Hi, everyone. I think you heard me earlier. So I'm Kapila. I'm head of data science for Secours Mercy Health. So Secours Mercy Health is also a not-for-profit health system. So we have around 50 hospitals with 3,000 plus providers. What we do is, I'm the head of data science, so responsible for ensuring the data science value realization. So meaning data science use cases which can deliver value to our care providers, to our HR teams, to our supply chain teams, and so on and so forth. Now, having said that, my background is in data science and machine learning. So prior to BSMH, I was in consulting where I was doing data science and machine learning consulting for healthcare, and pretty passionate about this space. And I firmly believe that data science and machine learning, AI, and all these new technologies, right? I believe in their promise for making healthcare simpler and better. So this tryst with Secours Mercy Health is essentially to check if that is just my fancy, that is just my belief, or that is really true. And if not, then what are the factors hindering it, and so on and so forth. Sorry for the long introduction, but I'm really excited to be here. Thank you so much for your time, and passing it on now.
Hello, thank you. Mic, you working? Okay. My name is Dave Lund. I'm the Senior Director for Healthcare for a company called AnyClip. We are a startup organization based out of New York City with original starting from Israel. AnyClip is a visual intelligence company. We extract data from previously recorded videos, Zoom, MS Teams, audio recordings, and what have you. So for me, I've been in healthcare for a number of years now, so this is very exciting. It's very much leading edge. I've been following this organization and decided to join here in this past year. So very pleased to be here. My background is communications as well as business technology, so thank you.
Thanks, Dave, and everybody else. I'm delighted to be here, and I'm the general manager of healthcare for a company called Soul Machines. Soul Machines is exactly like what it says. It is a technology company based on AI, and we've created these astonishing digital people that are like live. They can see and hear you and respond to you in real time. And my mission in life is to apply this technology for the betterhood of humans in healthcare. So looking forward to speaking with everybody today and working out how together we can start solving some of the unmet needs in our sector.
Well, glad you all are here. So Karl Hightower, Senior Vice President and Chief Data Officer, Novant Health, which is a healthcare provider system in the Southeast United States, 16 hospitals, about 700 clinics, 40,000 employees, about 1.5 million lives, roughly, underneath it. So my responsibilities are everything data, cradle to grave, storage, usage, strategy, analytics, integration, devices, how they're moving, connecting, and then with that comes cognitive computing. So AI, let me just do that. And we've really, since I came in 4 years ago, and I came in from outside of healthcare. So I've worked every other industry. This was the last one on the check mark, and I was stupid enough to say yes. Sure, I'll take it on. It has the most potential, and it also has the most problems. You get into all of the things that you want to do and all of the things to make it useful, and you start hitting walls very, very quickly, because contextualization is everything. And putting things into flow. You have very, very intelligent people who want to interact with you on how things should work. So you've got to be very upfront. You've got to be very transparent about how you put these things in. So from the very beginning, we came up with a framework and a strategy for it. So I'll start off with the first thing on this is we broke out our AI, cognitive computing, into 3 main areas. We focus on a person, so a patient, a provider, a community member, team member, and we really want to know everything about them and how they interact, what are their needs. All of the things that you would do in a retail-like environment, we brought into healthcare so that we could interact more with our community as you start to get into social determinants of health. This actually really paid off when we got into COVID. So we were able to understand people, where they were, how they moved, how they interacted, how they transmitted the virus. And we also started to get into pathways of care when they walked through the hospital. So what information we knew about them, what was the likely outcome of their condition, and what was the best way to be able to treat them. And that's part of our digital twins. We start to push that forward. The second big area of opportunity for us was back office and operations. So a hospital, all right, it's a giant logistics problem. So how do I manage the beds? How do I know who's going to come in? How do I staff it? And how am I actually putting in the things at the right place at the right time? So that was a big move for us, was where are the low-hanging fruit for putting in different material AI products. And of course, finance is an easy one. Automation, revenue cycle, how do we do this? How do we make sure that we're creating as much value for the company on collecting revenue and making it easier for the patients to understand their bills? The last one is the hardest one, and that's clinical. As we get into this, this gets into how do you have any solution, and this is where we're going to get into, I know, a lot more discussion on this. How do you have any solution that is transparent enough, powerful enough for the clinical users to have in their flow and for them to buy in and trust and it be of benefit coming forward? You look at all of the things that are about a person, all of the events that are cobbled together, and how do you get the patterns out of that? How do you get the usefulness out of that and put that in? A lot of the models we put in are heart failure, being able to predict that. We have opioid use models that we put in. What's the likelihood of someone to be addicted to a drug? So a lot of those things we've put in, but it's been very in use with our clinical staff to tell us how they would use it. What are the operational things that they would do if given it to them? So that's kind of just a little bit of what we've been working on.
Yeah. Karl, thank you. You listed out a lot of really great areas where AI is making a huge impact in healthcare. And out of all those industries you worked in, healthcare is the best, right?
It is the most challenging.
Most exciting. So beyond that, I'll turn it over to the other panelists. Are there other areas that you are seeing where AI is making a big impact in healthcare, or your organization specifically?
Yeah, well, I was really interested in what Karl said. I love this AI. I love it. I mean, what do you say? Really good maths. I don't know.
Statistics.
Come on.
All right.
But how it's applied, and your points are really salient, I think, because we know that there's a lot to do, and AI is not going to replicate 1 billion doctors. It's not going to replicate the pure trust between a skilled physician and their patient meeting in real time and knowing each other. But it can help. So, I mean, I think the idea is, instead of looking at what will be a perfect replacement or extension, it's looking at what these multiple touch points are that can collaborate together in a way that means that we can start bridging some of these gaps. And the point that you make is, let's say, you know, you have a powerful data set around maybe opioid addiction. And one of my projects that I'm incredibly proud of is to do with tobacco addiction. And we built the World Health Organization's first digital health worker, launched by the Director General of the World Health at the early stages of the pandemic. And I'll just tell a little bit about that story, is that big tobacco in the early stages, sort of April of 2020, were misbehaving. This won't surprise any of us in this room. And they were using the uncertainty and confusion at the early stages of the pandemic to spread research that tobacco consumption was potentially helpful to you in keeping you safe from the virus. So the WHO had an acute problem. They needed to solve that particular piece of misinformation. They wanted to solve scale. Their own health workers were, we know, struggling with the volume of work they had to deal with, but also raise risks of tobacco users and their vulnerability to the virus. So we built a digital one. Her name was Florence. They named her Florence. She speaks 7 languages, and what she does in terms of addiction is she can read the emotions of the user. So our technology can look, like if I'm looking at you, Karl, I would be reading the 16 data points on your face.
16.
Oh, you're anonymized, right? I'm not taking your privacy. I'm looking at your facial skeletal structure, which fires some information to my synthetic brain, which makes me in real time respond to you. So the users feel seen and heard. Their data is collected, and they're given high-level support and confidence to quit tobacco. So this is one piece of work that we're doing, and I'm thinking that the points that you raised are where some of these solutions, and we call this empathetic AI, humanized AI, can sock it in to some of these other data sets. Is that helpful, Mona?
Yeah, that's great. Thank you. I think I'm going to move it to the next question. There's so many good ones, and I want to be sure we get through them. But Karl, you had mentioned that healthcare is definitely one of the most challenging industries. So this next question really points to that. What is uniquely challenging about leveraging AI in the care provider space? And what's an example? Kapila, I'll ask you to answer that one.
Yeah, I think it's an interesting question, because if you ask me what is uniquely challenging, I can list like 10 unique challenges which I see, but I think I'll focus on 2 of them which I feel are the most pertinent ones. See, the first is incorporating the health inequity in the data model, in the AI model. Now, health disparities, health inequities are real. We've all seen them. Because they are real, they permeate in the data. And when they permeate in the data, they permeate in data science models or AI models we build on top of them. Now then, right, we have 2 options. Either we just say that, hey, we know that for this particular problem statement, the data, there is, because of health disparity, we cannot do justice to this segment of population, so let's keep it out, and let's build the model for the rest. But then I'm just adding to the health disparities another dimension. I'm adding on top of it. I'm adding another layer of health disparity. Second is I build a model still on all the data and somehow either put it in production and say to my users that, hey, when you're using for this particular population segment, just be cautious. But that again is not a very good approach, right? So incorporating the fact that there are health disparities, one. Second, acknowledging the desire that I want my models to be able to address these health disparities at some point. And third, making sure that this happens in production environment. This, I believe, is one of the biggest challenges. So meaning you put a model in production, but at the same time, you have to have a governance framework which ensures that wherever there are health disparities or health inequities, your model is able to give that much time to its users, to itself, to train itself to become better. So that, I believe, is the biggest challenge which I see. Second, which actually adds to the gravity of the first, is in the care provider space, right, when we are building models. Now, medical science is a complex field. Like, it's an understatement to say that it's a complex field. So if you talk of clinical models, how do disease progress, right? CHF, we still do not have very clear definitions on what are the different stages. I mean, you'll find literature which will say that definition, but it's not easy to really pinpoint from the data how the disease is progressing. Now, when data scientists or AI developers are building that model, because of the complexity of the field, they just cannot get into all the medical details. But at the same time, if I had just have a medical SME on the team who's helping me, there are biases from him which can flow in, and at the same time, he needs to continuously upgrade himself with the latest which is happening in this field, because the field is continuously evolving. So the second challenge is, which adds to the complexity, that having those people in the team which can understand both data science, AI, as well as be competent enough to at least comprehend the clinical information they are being given. It sounds easy, that just being able to comprehend, but then, like, data scientists are, they have their personalities, right? They are very much statistically oriented, mathematically oriented. So if you ask them to absorb something which is clinical or domain specific, at times you'll feel resistance. So having those people in the team which can understand both clinical world as well as data science world, it is the second challenge which we face. So I think these are the two challenges, Mona, which I see in my day-to-day world when it comes to deploying the AI models and providing
Yeah, there's so much complexity in the space. I mean, if you think about just AI alone, just the technology required and the process and all of that. And then, of course, the clinical side, which is its own thing. It's always complicated. Yes. Any other thoughts on that?
Really simply, one word: trust. You know, I mean, you have to build this trust, and I don't think it's going to happen overnight. In some ways, the system in places has become so acutely broken. I mean, let's think statistically about mental health, for example. You know, almost 1 billion people on the planet identify as having some type of mental health issue at some point. So we know depression, anxiety. If that's 1 in 6 of us, and the mental health support can reach, what, I don't know, less than 10% of that population, it is acutely broken. So it's the idea of some sort of collaboration and building some trust so that we can get rapport, multidisciplinary rapport, led by clinicians in order to be able to solve some of these issues. That's my thought.
You're also looking at traditional means of delivering care as opposed to changing it to concentric circles. So look at retail. You used to go to a shopping mall at a point in time, right? Well, okay, how do you shop today? So you think of the evolution of going from a shopping mall to more big box to small box to e-commerce. You still have an up and down the line, and you have to look at how are you going to leverage things where people are. So not everyone can get to a hospital, so how do you start to extend out different services? And how do you start to make that much more of a commerce that can go out and not be held from a scarce commodity?
Totally, and you're speaking my language. We also have a workforce crisis, you know, and our view, again, it's exactly what you're saying. If you try and revolve the care around the person and meet them where they are instead of telling them where they should be, it gets a lot more interesting.
Yeah, I think Karl, you're really saying at its core is how do you scale it, right? So it's going to address the 10% or whatever it is for mental health, and how do you get it out there? And I think also there's a fear factor too with on the clinical staff. You know, what is AI? Is it going to replace my job? How does it work? What is
God,
it?
I hope so.
Right. But I think scale is a big challenge, and I think AI can accomplish that.
Yeah, I know one of the things to get the clinicians to buy in is we had product teams. So we have clinical leaders in our product teams. Why? Every single morning they want to hear. So when COVID started happening, we wanted to know what variables were worthwhile for it on the ground level. So that changed so quickly, we had to have the clinical leaders. The hospitalists were always on those calls every single day, and they became very adept at understanding the models. And they also got in very quickly. We became very adept at knowing the treatments. And so we started expanding it out. This is where we're trying to push for digital twins. So you get into, okay, so at a certain point in time, you're going to break modern computing. So if you're looking at getting into specific pathways and treatments for people, and everything about their health and wellness, it can't be done with the way that computers process today. It's where you get into quantum algebra and quantum computing, but at the same point in time, I mean, this is the dream of personalized medicine for each individual person. And that's really the end goal of AI, is that health and wellness
Yeah.
for each person.
And predictive, right?
Well, yeah.
Absolutely. And I think that really dovetails nicely into the next topic, which is really what's critical to success in this area. And I think as providers, we have no choice but to be successful in this area. If you look at even what's happening today, not being able to hire enough people, nobody can hire enough people. Also looking at our aging population, so many of our providers retiring. So we have a pretty critical situation, and we have to figure out ways where we can still take care of people, because we're responsible. We have to take care of people without this live person, one-on-one for every situation, because it's not needed for every situation. So I think when we're looking at what's going to make us successful, first of all, we have to be successful. We have no choice. Really looking at ways where we can elevate human work, look for areas where things don't need an experienced person talking to a patient to do them. Is it a nudge, a guide, a check-in that's automated? We can certainly look at doing that. I think we also need to look at how we automate our automation. So if you look at governance, obviously you have to have governance in a process like this to make sure that you're auditing things, there's no bias, everything's working accurately, and you can automate your governance, and that helps move things much more quickly. One other thing that we have done is we have sort of shared the love, and my team actually has trained 400 plus and growing citizen developers within our organization. And I mentioned this previously, they don't like to be called citizen developers. They're called automation designers at our organization. But they have other jobs. This is sort of just something that they were interested in. They wanted to automate some things themselves to help in their own work and their team's work. And that's really added to the number of automations across the organization, almost 2,000 automations in less than a year. So definitely spread the design capabilities, allow people, trust people that they'll be able to do it, and then have those automated processes. And then I would say also, as you're diving in, those of you who have experience in this area, start with the low risk kinds of automations so people can see how easy it is, how it works, and then you can move up from there. But it's great to start somewhere.
So from challenges, we've kind of left off the most obvious one, data quality. The data quality coming out of the EHR and what people are putting in is abysmal at best. And especially when you look at, if you're trying to figure out what's going on with a person, you're going through notes. So the natural language processing and contextualization of what that is, given the quality and also just the personalization that a physician will put, that a nurse will put, that leads to a tremendous amount of error. And this eats up data science team's time. It eats up a lot of governance time. And this is where you end up hiring a ton of data engineers to go through and clean up the mess that is the EHR.
So garbage in, garbage out is,
Oh, yeah. But it's also one of the ones where the EHR vendors are very much just tell them to enter it better. I'm sure I'll get right on telling them that while they're practicing medicine. And it's a big challenge to make sure that information is accurate. Because if it's not, you can make big mistakes on recommendations of medications, treatments, or ignoring someone who needs it.
All right, this next question has Erica written all over it. 40% of people on Earth have no access to healthcare. Clearly, we have lots of work to do in the healthcare space to provide high-quality care to those in need. How does AI fit into future innovation in healthcare? What sort of innovations might we expect?
I'm thinking of Karl and your retail model now, and that this panel is around experience transformation, right? So Experience means how do we reach the places that we don't touch today? And it's not going to be, I mean, AI is a big bucket term, but it's going to be a family, an ecosystem of different types of technologies that are going to do that. We have one that will play a tiny role in the sea of need, right? What we've done is we've made a digital workforce. We have digital people who can take the load, maybe sometimes up to 40, sometimes 70% of the workload of humans, and extend the reach of the human. Let me put that into context. So instead of trying to take somebody's job, it's about making their job better so they don't have to do the bits that suck, frankly. 24/7, multilingual, repetitive, day in, day out. How do you lift that off the person? Let me say it's a nurse. And then their job is better, so they stay. They don't burn out so fast. So I think one of the ways to think about this 40% of people on the planet whose care is not met is to think about the people who provide the care today, how do we care for them first in this concentric circles, is that those healthcare workers need care, and then how do we reach the ones better and a safer with cleaner data, better real-time access, and also thinking around inclusion and the exclusions that exist today. A lot of people are shut out for reasons that aren't necessarily financial. They might be cultural or gender or whole piles of different bias that mean they don't get the care that they need. So how do we take some of the lessons, and AI can help us here too, in getting the care to the human that needs it?
Right. I would also add geographical too, right?
Totally.
Because of the population. So.
It's close to my heart, that one.
Right. And I also, this is probably a controversial subject here, but virtual physicians and clinicians may be able to help fill the gap, because let's face it, to train a clinical person is at least a decade of work, of training, education, life. And how do you get that to scale to cover 7+ billion people? You can't. But you could count in areas, you could use virtual physicians and nursing care to cover areas for people that are not getting that type of coverage. Of course you need the infrastructure, of course, but in the United States, we have an existing telecom network and cellular network, but if you go to Africa, there is no infrastructure other than cellular. It's all cellular and it's high speed. And it's actually even getting better.
I mean, I deliver it now, digital health workers to Africa, Asia, and yeah.
They leapfrogged. So I was in telecom when we were doing that, air mailing in and just dropping in the cell towers. So you've got to leapfrog where we are. We're still thinking of a model where people are going in. You're still thinking about extending the hospital, and you've got to think of what's next. So the vision of our chief medical officer is he wants a tricorder. Literally just like the ability for those things. So you get into it, there are devices that are starting to make progress. And you get into this is how do you get something in someone's hands? And I know we have a partnership with Taito where you give that to a mom and they can actually do the virtual visit and give that information and that data.
But it's in their hands already. It's a cell phone. I mean, everyone's got one of those. And to be honest, you can do a hell of a lot.
We already have everyone has a device,
Yeah.
right? Everyone already has a device. Can we leverage that? So really looking at kind of where this could go, we think about personalized medicine. Karl, you had mentioned a little bit about that. Where could we go with personalized medicine with AI, and where do we have to look at some of the privacy concerns that may trip us up? Karl.
All right, so all the useful information in healthcare happens to be on the PHI list. So for all of your models and all of the things that you're looking at, you're battling against privacy. So this is getting into a level of, as social media had it, you've got to get on different terms and conditions. You've got to also come to an understanding. So one of the examples I use is if I can find cancer 5 years earlier and avoid any type of harsh treatment, any type of surgery, are you willing to give up your personal information for that? You give up your personal information for shopping, for social media, for everything else. What about your health? And that's going to come into a point where people are going to have to start looking at how they view it as their own accountability on their health. And are they willing to do that? There are also some things that you can do for the health record. You can start to centralize it if you wanted to. And actually, I think that's probably one of the few ways that we are going to be able to get a good view of what's going on with people. And then you can leverage things like blockchain on who you authorize to be able to have access to that record. So, I mean, there are ways of doing this. It's just that everybody has a little bit of piece of the pie that they want to take, and they're not willing to compromise at this point. So, until legislation hits that allows for that, we're kind of still battling.
Yeah, and the sort of cost-benefit analysis, right, is that I'll give away that if I get that, but I need to know what I'm going to get for it. And we're starting to see that evolution where people will opt in. I mean, we've made virtual health workers, virtual doctors. So people will choose to have it anonymous in order to get one experience. And if they want a deeper, richer, more customized, personalized experience, they'll opt in with an insurance number or patient record number in order to get a different type of experience. And we're seeing one of the biggest drivers in terms of empowering people with AI is choice. And I think sometimes it's not going to be a binary situation. There's going to be a range.
Yeah, well, I think that's why you see healthcare, entrance into the healthcare industry, Google, Amazon. It's all about the data and what we can do with it and what consumers want us to do with it. I really do think, to your point, Karl, we give all our information to buy something online. Would we give our information to become healthier? You'd think so, but all of a sudden it's like a different conversation once you're talking about your health. But I think a lot of those tech companies have really seen the opportunity there, and consumers are going to demand it. I mean, they really are going to demand that data be used appropriately and to help them advance. So let's change topics just a little bit. Talk about HR. It's definitely an area where there's a lot of opportunity for AI. In our organization, for example, HR was actually the unlikely sponsor of starting our intelligent automation program because they said, we want to build a digital workforce. And that was the task, and the team came together and was able to do that. So it was an interesting perspective, looking at it from a sort of digital workforce perspective rather than how are we going to automate all this stuff? What sort of ROI are we going to get? It was an interesting perspective on that. But what do we think about HR and AI, David?
Yeah, Mona, great question. And you're absolutely right. HR has taken a leadership role, and I've seen it in several AI projects around the country, which maybe it surprised me a little bit. But they are they're stepping up. And what really I think has been driving is obviously AI is the data is getting better, and the opportunities, different products, different services are coming out. But the COVID really is driving that. So the great resignation that has happened here in the last X amount of time, at least in the United States, is important to them because they have to fill these holes. They have to, across the entire care continuum, they have to be helping different groups. So in one organization that I've been working with, or I've been able to witness is they worked with IT. This organization had over 400 different applications. Actually, the number is 600, but I'm going to scale it down because it seems crazy. 400 different applications that the IT group has to support. So that's everything from GE MRI machines to, Medtronic pump machines to Microsoft to Epic to you name it. When there's a problem, the employees open a trouble ticket. And it was taking them a better part of 36 hours to close the average ticket. At the same time, their key employees were in the support desk in IT were leaving, either because they were burnt out, or they were laid off or what have you. And this organization was also going online with AWS and Epic, which is the first in the country. And they were like, we're heading for a train wreck. I mean, we see it and we know it's coming here. What do we do? So, self-promotion here, I asked them, can you see any fit? And they said, oh yeah, we can train people. We can do video recordings. And if you can overlay these recordings so that my technician, my IT tech support person doesn't have to sit through 5 hours of recordings, he or she can get to the exact moment on how to reboot your AWS server because of a storm that's hit your main hospital. How do you do that? Well, that's at the 10-minute mark in 14 seconds, and it goes to 14 minutes. How do I reboot Epic, or how do I analyze where are my analytics on this particular product, or reboot, get my EMR machine running? I'm sorry, my EKG operational. So what they've been able to do is lower that 36 hours down to just a matter of hours, and it's had a dramatic effect on that organization. And very, very pleased with it. And again, it was HR that really was at the forefront. So I'm not saying it was surprising to everybody, but it was surprising to me.
Yeah, I mean, to that point, likewise, is the HR organizations we've worked with acknowledge something really quickly. I mean, one, the stress, and the mental health and physical health toll on their scale employees. Also the massive demand for knowledge, training, access, information. We all know in a crisis you need tons of communication. You need to be over-communicated with, particularly if you're remote. And that's obviously been the case for half of the planet for 2.5 years or so. And so how are they going to meet those needs? And I guess that's why they've been at the forefront of automating in some degrees. And the other thing that we've seen is this, work from home hybrid concept is slightly bizarre in my mind at the moment. It's the conversation that appears to be hybrid workplaces mean some of us are in the office or the hospital, some of us are at home. And I think trying to place people on a location seems odd now. And to me, hybrid is a combination of your real physical workforce and your digital workforce, wherever it may be.
Yeah, and I think just to kind of echo what you guys said, right? HR in our organization also has been an unlikely sponsor. Like, we were not expecting them to come forward and talk about using data science and AI in this space. Especially for us, I think one factor which has triggered is that pandemic has resulted in physician burnout, in nurse attrition and stuff like that, right? So now that it is happening and happening at an alarming rate, I think HR teams are starting to realize that they need to be able to really figure out what are the drivers. While theoretically we know what are the drivers, but then they want to get ahead a little in the game so that they can proactively ensure that they can increase the workforce satisfaction, especially when it comes to registered nurses and physicians. So one other area of this HR and AI intersection has been these models to understand the drivers of nurse retention or physician retention and stuff like that. But then having said that, it's definitely an opportunity area, but then is the data in the HR field ripe enough to do that kind of work? I think that question merits a separate discussion altogether, because there are still some gaps, right, when it comes to data from an HR perspective. So subjective factors like management quality, like the facility environment, the facility infrastructure in which the registered nurses are working, that itself is not so very well documented. So I think it's right now, definitely HR is starting to sit up and ask, and there is a need. I think we all agree to that, but there is still a lot of work to be done when it comes to data and having those qualitative data which really have an effect on how people perceive their association with an organization. So I think getting that data is probably another area where AI can someday help, but yeah, that's what I see.
Yeah, I wonder, I think about how we were talking about the whole evolution of shopping, for example. We used to go in person, and that was kind of a thing, and we enjoyed it. And now you just hit one button on Amazon, and your package is delivered. And when it's delivered, you're like, what did I order? I don't even remember. It's just something we do. We don't even think about it. And I think about, what will it take, or how long will it take for us to get to that point where AI is just what we do. I was talking with one of my colleagues in HR, and we were saying, when teams come to the table to ask for approval for new employees, new FTEs, should we ask immediately, could any of this be automated? Can we put in place a digital coworker rather than hire an actual person, or a temp coworker that's digital? So what would it take for us to kind of get to that? It seems like it could have such a great impact, especially with the environment that we're working and living in.
So, having gone through many of these in different industries, I'm thinking Lean Six Sigma type of things. Process. Just go look at how you do things today. They are brutally manual. They're just because somebody got something in and they never went back to revisit it. So, if you want to automate, I think you need to first just actually do the deconstruction of the processes. AI is a tool, like every other tool. And if you don't understand how you're going to use it or what the processes are, then you failed. So that's the biggest thing I've seen so far is there's so many vendors, so many things, you put them in, and they fail. Why? Because you don't understand the process you're trying to actually execute to. If you want to get into how do we start to take off of those things, understand the processes by which people are working.
Can I ask, how do you define, because you're speaking my language here, in terms of setting out what your North Star is, what is your KPI for this particular piece of work, where do you want your organization to be in 3-5 years, what are the service delivery levels you want for your patients, as well as maybe acquisition, retention, all the other normal things. How do you define those metrics yourself in order to know how to chart your way forward?
So it depends, always depends, and you're looking at the different things that you're going after, and you got to figure out what your baseline is.
Yeah.
And that's one of the harder things is we usually work with different business areas to get a baseline defined, and then you start to go into how do we think we'll make improvements. So it was really interesting when you start to look at HAIs, hospital-acquired infections, and everybody wanted to buy every tool on the face of the planet for this. And what it came down to is it was just basic intelligence of following the processes and making sure you communicated to people.
Yeah.
And that improved things dramatically was communication.
I think you're making a good point. I mean, I worked with one big hospital group who said to me, Erica, we want people to stay in our hospitals, we've got X amount, for no more than 4 days. That's what we want here. How are we going to get to that? And I think it's sort of part of what you're saying, and some of it might be just intelligence. Other times it's maybe some significant automation and paradigm shift.
And I think, to your point, Mona, right, if HR, like this HR and AI intersection also raises the point about responsible AI, right? If HR comes and says that, hey, if I get a new job request, how do I ensure that, is there a way for me not to hire and get a digital worker in place, right? Which is good, which we'll do. We'll try to automate tasks, what people are doing already in the organization. But then I think that brings responsible AI to the forefront, right? Because we want to be responsible in use of AI, in automating, in streamlining something so that people who are doing this work already, they get to like either upskill themselves, do better work kind of thing. So I think with HR and AI kind of marrying a little bit more, that responsible AI question will have to be answered at some point. We don't have answers right now, but it will have to be answered at some point.
Great. Well, thanks, everybody. Well, I think we are out of time, believe it or not. Thank you so much for sharing your insights, and thank you for attending our session today. We appreciate it.